and welcome everyone. Thank you for joining us today. It's great to see so many registrants from the public, private, academic, and governance sectors in healthcare across Canada joining today's presentation. I'm Chad Leaver, Director of Performance Analytics at Canada Health Infoway, and I'll be walking you through the results from our 2018 Canadian Physician Survey. Before we begin, please be advised that today's presentation will be recorded. To support the recording, all lines have been muted. We'll notify all registrants by email when the recording is posted to our website. The final report document, available in English and French, includes the data presented today and the technical appendix, and will of course be posted on our website immediately following today's presentation at 2 p.m. Eastern. At the end of the presentation, we'll be happy to respond to your questions. So throughout the presentation, if you think of a question, please write it down if you're attending the session in a group setting and share it with the person hosting the WebEx throughout the presentation. Your meeting room lead or those attending independently can simply type in questions in the Q&A panel at the bottom right of the WebEx window and send to all panelists. As we reach the question and answer part of the session, we will read out submitted questions for everyone to hear, and I'll do my best to respond. First, to set the context for the 2018 Canadian Physician Survey, it's important to acknowledge the collaborative initiative of the National Physician Survey, or NPS, that started in 2004 and completed national-level surveys up to 2014. The initiative with the Canadian Medical Association, the College of Family Physicians of Canada, the Royal College of Physicians and Surgeons, and the support from the Canadian Institute for Health Information and Health Canada surveyed all physicians, residents, and medical students in the country across this period. The NPS was primarily focused on physician workforce data and covered a variety of topics over the years. It was Canada's first national source for physician use of electronic medical records and use of electronic functionalities to support patient care and early measures of digitally enabled health services physicians were providing their patients, such as email and requesting appointments. You can continue to access prior surveys and data reports at nationalphysiciansurvey.ca. Physician workforce data, of course, remains a priority for Canada's physician leadership communities and is now collected through other means, namely the CMA's 2017 Physician Workforce Survey and provincial and territorial licensure renewal processes. The 2018 Canadian Physician Survey, the results from which I'll be sharing in a moment, focused exclusively on the use of digital health technologies in practice by primary care and specialist physicians. We developed the survey in consultation with the CMA, CFPC, the Royal College, and CIHI, drawing from an initial set of existing questions from prior physician surveys and adding new questions for expanded areas of inquiry around digitally enabled health services. The approach for the 2018 CPS did not attempt to replicate the methodology of prior national physician surveys, which were themselves substantive efforts that also included continuing medical education credits for completion. To capture a national sample of both primary care and specialist physicians in Canada, we undertook a novel approach in partnership with the Canadian Medical Directory, Scott's Directories, a division of Owen Media, and provided physicians that completed the survey a chance to win one of two prepaid Visa cards. Physicians across Canada were invited to complete the Canadian Physician Survey between January and March 2018 via a multi-method direct-to-physician fax invitation and national communications campaign. The survey instrument and all promotion and recruitment communications were available in French and English. In partnership with Scott's Directories, the 4-page, 24-question survey instrument was distributed by fax to more than 45,000 physicians listed in the Canadian Medical Directory who have indicated fax as their preferred method of communication. Approximately 8,500 physicians with an email address on file in the Canadian Medical Directory master database were also invited to participate. Fax and email reminders were sent 2 weeks following the initial invitation, and 2,000 telephone reminders were made to select cohorts of non-responding physicians in the last 2 weeks of the field period. Throughout the promotion and recruitment period, Canada Health Infoway and CIHI broadly communicated the opportunity to participate in English and French across social media and other national communication channels. Physicians could choose to complete the survey and return it by fax, or complete the survey online by entering their CMD ID number located on the fax invitation, or by entering their practice, contact, and demographic information to support reconciliation to the Canadian Medical Directory master file. A total of 1,400 physicians across Canada completed the 2018 Canadian Physician Survey, among whom 1,393 were registered to practice in Canada and were currently providing patient care. Our sample for primary care physicians is 799 and specialists is 594. The 2018 CPS sample includes responding physicians from every Canadian province and the Yukon Northwest and Nunavut territories. In relation to the national sample of physicians in Canada, the CPS response rate was just under 2%. Namely, the 2018 CPS is comprised of fewer younger primary care and specialist physicians, fewer female specialists, fewer Ontario primary care physicians, and fewer specialists from Quebec. Our approach and decision on weighting the data to support reporting national results generalizable to the Canadian physician population was developed by CIHI using the 2015 CIHI physician workforce data. Weighting estimates were applied to all 1,393 responses, representing the estimated total of over 78,000 eligible physicians across Canada. Non-response adjustments were made based on a combination of province, physician type, age group, and sex. And after the non-response adjustments for demographic groups, the estimation weights averaged 56.3 and ranged from 13.2 to 136.1. To ground our approach, we conducted a comparison descriptive analysis of weighted and unweighted survey variables, and our analysis demonstrated very small percentage point differences across all variables, suggesting non-correlation between non-response and responses. We acknowledge the CPS sample differences to the Canadian population of physicians, and as noted above, our report presents unweighted results. Our results are therefore relevant to the national sample of physicians responding to the 2018 CPS, but are not, in fact, generalizable to the national physician population or directly comparable to the National Physician Survey results or the 2017 CMA Workforce Survey results done in the past. Please, of course, see our technical appendix in the full report for full details. Now, let's get into the results from the survey. This section presents primary care physician use of electronic records and their impact on practice. Starting with use of specific EMR functionalities, 75% of Canadian primary care physicians responding to the CPS report using EMRs to enter and retrieve patient notes. While this is somewhat lower than the 2017 CMA Workforce Survey estimate of 85% of primary care physician adoption of EMRs, when we look at practice setting among primary care physicians responding to the CPS, this lower result in our sample is likely due to hospital-based primary care physicians responding to our survey. Among just community-based primary care docs responding to the CPS, use of EMR to enter and retrieve patient notes is 85%, commensurate with the 2017 CMA reported national estimate. Generating prescriptions, sending referrals, and use of electronic warnings for drug dose interactions are the main EMR functions used by primary care physicians in the 2018 CPS. A third of physicians report generating lists to support preventative care, and 29% report generating reports for quality improvement. And this is a notable increase from prior national estimates. We were also interested in electronically enabled referral processes. 29% of primary care physicians report they currently receive electronic confirmation of scheduled appointments for patients they have referred. 25% report receiving messages from pharmacists to request prescription refills or clarification. With e-consultation and exchange of clinical summaries to doctors outside their practice reported by 17% and 16% of primary care physicians in the CPS, respectively. Access to connected health information systems is high among primary care physicians, with 84% of CPS respondents saying they have access to patient information from outside their practice from provincial, territorial, regional, or hospital information systems. Looking at the middle panel, 34% say they can access this information directly from their EMR. 18% must launch an application without additional login requirements, and 46% do not have integrated access and must launch an application to search and view patient information. We know from previous clinician surveys that seamless integration supports a higher frequency of use of connected health information systems, more effectively supporting the use of these systems for day-to-day patient encounters. The table on the right illustrates that the main sources of patient information from outside primary care physician practices includes lab test results, diagnostic imaging, and medications not prescribed by them, followed by hospital visit discharge information and specialist care follow-up and clinical consultation letters. Optimized use of EMR or use of multiple EMR functionalities to support patient care is a key indicator of practice integration of technology into practice workflow and has been shown more broadly to impact both patient safety and practice operational efficiency outcomes related to models of the patient medical home and proactive population health management. This slide shows national results for primary care physicians from the 2018 CPS who are still paper-based, labeled in gray, and by use of multiple EMR functionalities, the three blue categories. While our overall report does not present results by province, we felt that for optimized use, presenting results by province or region here was relevant. As we see here on the far left bar, 31% of primary care physicians in Canada report using 6 to 9 EMR functionalities to support patient care. 38% are using 3 to 5, and 15% just 1 to 2 functionalities. By province or region, there remains some variability in the percent of physicians who are still paper-based, and the smallest group of physicians using 6 to 9 functionalities, namely in Atlantic Canada and Quebec, which may be explained by the fact that these provinces have the most recent EMR deployment programs, whereas other provincial EMR programs started in the early 2000s. In an effort to understand whether use of multiple EMR functionalities to support patient care is associated with duration of EMR use, or to answer the question whether over time do primary care physicians use more functionalities, we show here duration of EMR use on the left to our optimized use categories. While it's a small segment of our CPS sample, we see on the top that within the first year of use, the majority of physicians are using just 1 to 2 EMR functionalities. These are essentially entering, retrieving patient notes, and prescribing. The story here is that after 2 years, primary care physicians tend to have established their EMR use behavior and do not substantially increase the number of EMR functionalities they use to support patient care over time. There's only an 11 percentage point difference between the CPS early adopter group using EMRs for 1 to 2 years at 36% and primary care physicians using an EMR for over 10 years, 6 to 9 functionalities at 47%. Now, let's move to our results for use of EMR functionalities for specialists. It's important to keep in mind that across specialist clinical practice areas and hospital or community-based practice locations, the use of EMRs by specialists can vary widely to meet clinical requirements. We did have a large spectrum of specialist physicians complete our survey from maternal and child health, cardiovascular and cancer, mental health, and a number of other practice domains. In the 2018 CPS, 74% of specialists report they currently enter and retrieve patient notes. The next most common functionality specialists report using to support patient care include generating a prescription, sending patient referrals, warnings for drug dose interactions, and exchange of clinical summaries. In terms of digitally enabled referral processes, 18% of specialists report they currently receive electronic confirmation of scheduled appointments for patients they have referred. Generating reports for quality improvement or lists for proactive patient care or e-consultation with other specialists is rare in our sample at 10% and 6% respectively, and likely due to varying practice requirements of specialists responding to the CPS. Specialist access to connected health information systems is also high, with 89% of specialist respondents saying they have access to provincial, territorial, regional, or hospital information systems. Again, looking at the middle panel, 25% say they can access this information directly from their EMR, 13% must launch an application without additional login requirements, and 55% do not have integrated access and must launch an application to search and view patient information. As I noted above, seamless integration supports higher frequency of use of connected health information systems and more effectively supports use of these systems for day-to-day patient encounters. The table on the right illustrates that the main sources of patient information from outside their practice that specialists access includes diagnostic imaging, lab test results, discharge information, and medications. Given the variation in specialist practice and clinical requirements and the sample limitations I noted earlier, we do not present an optimized analysis for specialists in terms of use of EMR across different functionalities. In future, specialist surveys focus on specific practice domains or patient populations will likely offer the greatest insight into specialist use patterns of electronic records and value related to their use, as well as connected health information and digitally enabled health services. Let's move on to EMR use and impact on practice. On the left-hand side, you'll see overall 82% of primary care physicians responding to the 2018 CPS say they provide more efficient healthcare with electronic records. When looking at our EMR optimized user categories, we see that primary care physicians using 6 to 9 functionalities are more likely to say they provide more efficient healthcare with EMRs than those using just 1 to 2 functionalities. That's 92% versus 67% respectively. For specialist physicians, 77% say they provide more efficient healthcare with electronic records, and optimized users are more likely to say they provide more efficient healthcare with EMRs compared to specialists using 1 to 2 functionalities. That's 100% versus 69% respectively. Turning now to primary care physician satisfaction with their EMR, the left panel of this slide and connected health information systems, the right panel, that physicians use in practice, overall 71% of primary care physicians responding say they are satisfied with their EMR, 16% indifferent or neutral, and 13% dissatisfied. Looking to the panel on the left, when it comes to satisfaction with connected health information systems, 52% of primary care physicians report being satisfied, 23% are indifferent or neutral, and 25% are dissatisfied. Using more EMR functionalities has a lot to do with primary care physician satisfaction with their EMR and with connected health information systems. Physicians using 6 to 9 functionalities are more likely to say they are satisfied with their EMR and the connected health information system they have access to than physicians who are using just 1 to 2 functionalities. Turning now to specialist satisfaction with their EMR and connected health information systems. Overall, 58% of specialists responding to the CPS say they are satisfied with their EMR, 21% say they are indifferent or neutral, and 21% dissatisfied. Looking at the panel on the right, when it comes to satisfaction with connected health information systems, only 44% of specialists report being satisfied, 30% are indifferent or neutral, and 26% are dissatisfied. For specialists using more EMR functionalities, also has a lot to do with satisfaction with their EMR and the connected health information systems they use, 42% versus 82% for EMR satisfaction, and 36% versus 65% for connected health information systems. To quickly look at physician self-rated skills and knowledge to use electronic records, primary care physicians responding to the 2018 CPS self-rate their current skills and knowledge to use electronic records as very high, and the more functionalities used, the higher physicians self-rate their skills and knowledge. And when it comes to specialists, it's the same, with a very high self-rated skills and knowledge to use electronic records, and the more functionalities specialists use, the higher their self-ratings are. This next section focuses on our results from physician-reported patient access to practice-based virtual care and e-services. We asked physicians about a number of digitally enabled services that patients in their main work setting can use or have access to in 2 separate questions. We asked if physicians' main work setting allows patients to request appointments online by sending an email request, to electronically book an in-person appointment online, meaning that patients can send an available appointment date and time of their preference, or select an available appointment date and time of their preference and receive a real-time confirmation. We also asked if patients can use an online tool to request a prescription renewal, if they can send an email to you, the physician, or the clinic about a specific health issue or concern, if they can send a text message to the clinic or directly to you, the physician, about a specific health issue or concern, and if patients can visit with physicians virtually online by video, essentially like a FaceTime or Skype video call. We first conducted an aggregated analysis across all these digitally enabled virtual care services to estimate the percent of primary care physicians responding to the CPS offering at least one virtual care or e-service to Canadian patients. We found that overall 38% of primary care physicians currently offer patients at least one virtual care or e-service. And that is mainly driven by practices or clinics becoming more accessible to patients via email communication. As we show here, the bulk of the 38% is driven by the 24% of primary care physicians responding to the CPS, saying that patients in their practice can send an email to them or the clinic about a specific health issue or concern. To unpack this finding for a moment, we've seen from the 2010 National Physician Survey, the last time there was a question on physician use of email to communicate with patients for clinical purposes, that 14% of primary care physicians and 18% of specialists in Canada say they were using email to communicate with patients for clinical purposes. Infoway's 2018 survey of Canadians reported 10% of Canadians say that they can currently consult with their healthcare providers online using secure email. And while we find in the 2018 CPS that, as it shows here, 24% of primary care physicians say that patients can email them or the clinic about a specific health issue or concern, the variance is likely explained by more and more primary care practices having a practice website with email contact functionality and not necessarily direct email with physicians or physicians emailing with patients directly. Going back to our list of practice-based virtual care e-services, 13% of primary care physicians say that patients can request appointments online, 5% of physicians say patients can book an in-person appointment, and 5% say they can use an online tool to request a prescription renewal. When it comes to use of text messaging with patients, a new measure in the 2018 CPS, 5% of primary care physicians say that patients can text the clinic about a specific health issue or concern, and when it comes to texting a physician directly, 5% of physicians say patients in their practice can text them about a specific health issue or concern. Just 4% of primary care physicians say patients can visit with them virtually online by video conference. We also asked primary care physicians about how much of their daily workload they spend supporting electronic communication with patients. The majority of primary care physicians, 66%, say they spend no time. With those that do spend time, they report usually spending about less than 10% of their daily workload. There does seem to be an interesting cohort of 14% of primary care physicians spending about 5 to 10% of their workload supporting virtual care e-services to their practice on a daily basis. On the right, we also asked physicians what factors would support them to integrate electronic communication with patients in their practice. Having an applicable fee schedule tops the list for primary care physicians, and 28% say an alternative payment model would also be supportive. Guidelines to ensure privacy and security, improve technology and support services provided through medical associations or government bodies are equally important. There is also a cohort of 28% of primary care physicians that say nothing would support them to advance virtual care services to their patients in their practice, and perhaps have reached some balance of the service that they're providing currently. Our aggregated analysis across all the digitally enabled virtual care e-services among specialists found that overall, 47% of specialists currently offer patients at least one virtual care or e-service. This is also mainly driven by practices or clinics becoming more accessible to patients via email communication. As we show here, the bulk of the 47% is driven by the 40% of specialists saying that patients in their practice can send an email to them or the clinic about a specific health issue or concern. Regarding the other practice-based virtual care e-services, 3% of specialists say patients can request appointments online, 8% say patients can book an in-person appointment, and 5% say patients can use an online tool to request a prescription renewal. When it comes to the use of text messages, 5% of specialists responding to the CPS say that patients can text the clinic about a specific health issue or concern, and when it comes to texting a specialist directly, 5% say patients in their practice can text them. 9% of specialists say patients can visit with them virtually online by video conference. Again, we also asked specialists how much of their daily workload they spend supporting electronic communication with patients. 52% of specialists say they spend no time, with a significant proportion, 22%, spending up to 10% of their daily workload supporting virtual care services to patients in their practice. On the right, we also asked specialists about what factors would support them to integrate electronic communication with patients, and improved technology tops the list for specialists, followed by guidelines to ensure privacy and security, and support services provided through medical associations or government bodies are equally important. Applicable fee schedule and alternative payment model was mentioned by the fewest percentage of specialists. And of course, there's a cohort of 26% of specialists from the CPS sample that say nothing would support them to advance virtual care services to patients in their practice. This concludes our presentation of results from the 2018 Canadian Physician Survey. I'll take a moment to provide a brief summary while we let some questions come through. So in summary, 84% of primary care physicians and 89% of specialists we surveyed report that they have access to connected health information from care settings outside their main practice. The majority of primary care physicians and specialists, 82 and 77% respectively, say they provide more efficient care with electronic records. 31% of primary care physicians use 6 to 9 EMR functionalities to support patient care, and physicians tend to establish their EMR use behavior within the first 2 years of adopting an EMR. High physician satisfaction with EMRs and connected regional provincial health information systems has a lot to do with the use of multiple EMR functionalities to support patient care. When it comes to patient access to practice-based virtual care and e-services, overall 38% of primary care physicians and 47% of specialists offer patients at least one virtual care or e-service, mainly driven by practices clinics becoming more accessible to patients via email. While practices and clinics may be more accessible by email, it's still rare for primary care practices to offer e-services to either request an appointment at 9% or book a confirmed appointment at 3%. 4% of primary care physicians and 9% of specialists say they currently visit patients in their practice, or patients in their practice can visit them online via video, via a virtual visit. And finally, while physician reimbursement is an important facilitator, physicians say would help them to advance their provision of virtual care and e-services, guidelines to ensure privacy and security, improve technology and support services provided by medical associations, and government bodies are also critically important. And with that, I'll open it up for some questions.
All right, well, we've had a few come in. The first one is, you mentioned that physicians using 6 to 9 functionalities are more likely than those using 1 to 2 functionalities to say they are providing more efficient care with EMRs. Could this be because those using 1 to 2 functionalities are new users?
Great question. As I showed on the slide that presented years using EMR and the optimized use categories earlier in the presentation, there are actually cohorts of primary care physicians using just 1 to 2 EMR functionalities. So in Canada, that stat was about 15%. So it's not just the early adoption group of those using less than a year or 1 to 2 years, but all the way up to 10 years or more of EMR use. So just under 1/5 of physicians in each duration of EMR use category on that slide still use 1 to 2 EMR functionalities to support patient care. I think it really does appear that primary care physicians tend to establish the set of functionalities that they use within the first 2 years of use. And when we looked at specific EMR functionalities, only one of those functionalities seemed to demonstrate growth over time or within groups, and that was generating reports for quality improvement or audit purposes other than billing. Great question, thank you.
Lots coming in. The next one is, do any of these e-services include patients being able to view their own EMR?
No. So in the survey, we did not ask physicians whether patients in their practice have the ability to view their own record for that practice. I would look to our 2018 Connected Patients report to get the latest stats on Canadians reporting access to their own health record.
One of the issues reported in the media in the recent past is clinician burnout/burden as pertains to the use of EMR EHR. Do slides 18 and 19 reflect or refute this issue?
I think the slides 18 and 19 are around being able to provide more efficient care, and I think those are both a very good indicator that the more functionality is being used, the more efficient physicians are saying they are practicing. I don't think it's quite possibly a direct indicator of burnout, but for physicians to identify that they're more efficient, the more functionalities they use is a really good indication that use of EMRs is perhaps assisting with physician practices being more efficient.
Next question, was a list of EMR functionalities given to physicians, or was it up to them to determine the number of functionalities of the EMRs they used?
The list of functionalities was actually given to physicians. It was a broad list of up to nine functionalities, and when we do plan on posting the data set on the University of Victoria Dataverse early in the new year, and along with that we'll be posting the full questionnaire, so you'll be able to see that full list.
Has your response rate on this survey been typical of past surveys or for primary care physicians and or specialists?
Great question. I think given the novel approach that we took and different methodology from national physician surveys, we did not obtain the same response rate that was previously obtained through prior iterations of the NPS or the 2017 CMA workforce survey. It was much lower, but we, as I said, we looked at our sample compared to the national physician population. In some provinces, we actually obtained more physicians in certain provinces, but as I said before, we had fewer from Ontario and differences across some age groups and gender. So I think our effort through this process signaled that this is actually a great way to capture a physician population, but more difficult to capture a more nationally representative sample.
This person's wondering if the presentation, the slides will be shared.
Everything on the slide shared today are content that is being posted at 2 p.m. from the report. I made some slight differences to the presentation for ease of presentation, but all this content is fully available, including the technical appendix at 2 p.m. today.
Next question. Were the questions about email communications specific for secure messaging, or were generic, including the personal email or SMS that physicians and patients have for personal or professional purposes?
Good question. We did not differentiate the mode through which physicians could be communicated with, whether it was their personal or via a channel, for instance, from the practice website via a portal and secure messaging functionality within a practice website. So we just asked generically, can patients text you? Can you or your practice receive an email? I think your question's really good because it suggests to us as we've looked at these results that going deeper into the channels of communication electronically with physicians via messaging or email will be a good focus of a future survey.
Have you cross-referenced your data with industry providers of EMR software and platforms? I'm not sure if I fully understand the question. Maybe if you want to provide some more clarification, I could help. But we don't cross-reference this with the functionalities that are provided by vendors in the Canadian marketplace. These are all fairly, I would say, essentially standard functionalities related to EMRs for the most part, except, for instance, the new question we were asking about physicians receiving electronic confirmation of a referral. This is a functionality that may not be available in EMRs across the landscape, but important for us to measure. This person's wondering why you changed your methodology this year.
Well, it was a collaborative effort, and I think the reason for changing the methodology is that the initial the methodology embarked upon by the National Physician Survey and CMA was grounded in those associations' access to their memberships, and was a much more substantive effort. It had to do a lot with budget and timing, and we've seen other surveys that were facts-based with, like the Nova Scotia MAP Nova Scotia Primary Care Survey, where there was very high response rate from primary care physicians through that process, and we had hoped that we would receive just as high as a response rate. I think it's a signal that fax processes are still embedded in a number of physician practices, as we know, and it was a novel approach to expeditiously embark upon a survey that attempted to capture both primary care and specialist physicians.
Are the results available by sub-provincial region?
So I'm assuming you mean like urban, rural, or different, census metropolitan areas, and unfortunately, no, they are not. We're providing results entirely by national level results, but when we post the data on the University of Victoria Dataverse, the results are coded by province, and researchers and analysts can approach the data the same way we have to look at different provincial responses.
Great. All right, just a couple more, and then we'll give Chad a break here.
Okay.
I noticed you have not made any reference to the Commonwealth Fund Survey, the physician component primary care. There was one in 2015, and there's supposed to be one in 2018. Is there a reason?
No reason why I didn't specifically mention it. I did want to focus on Canada's efforts embarking upon national physician surveys. Yes, the Commonwealth Fund has been a really important source of information for Canada Health Infoway over the years. I think since its first one around the 2010 period or just before. Yes, it was done in 2015, and we've consulted greatly with Kai, who's leading the next iteration of the Commonwealth Fund Survey, which will be administered to primary care physicians in 2019. So we look forward to the 2019 Commonwealth Fund Survey results to provide really the next national tracking metric for physician adoption of EMR and connected health information systems, as well as a few other variables. As you probably know, that the Commonwealth Fund Survey has a number of different focus areas, of which technology is one, but it's a small one.
This person's wondering, given the response rate, how representative are respondents of Canadian physicians and how generalizable are the results?
Great question. As I said earlier, we made every effort to apply a weighting methodology, and those weights were excessively large given our response rate, and our results are not actually generalizable to the Canadian population of physicians, which is why as I interpret the study results throughout the presentation, I'm often saying, the primary care physicians responding to the Canadian Physician Survey, this is the result there. I think we do have a really good sample across the country. We were quite shy, we were shy on Ontario responses, as you'll see in one of the earlier tables, but I think that's still a good survey of physicians across Canada, providing some excellent input on their use of digital health technologies.
Did you differentiate between providers and practices that provide services for a fee to patients versus practices that are covered under the provincial publicly funded insurance plans like OHIP?
Well, we do ask in the survey physicians' primary source of income, whether their payment model is essentially fee-for-service, or if they're in a capitation model, if they're salaried, or if they're in some other model, which is typically some blend of capitation or fee-for-service. So we don't present results by practice payment model or physician payment model in our summary report, but that variable is available in the data set when it's posted to the UVic Dataverse.
All right, should we just do one more?
Sure.
It is unclear what the relationship between availability and uptake. Is there a way to discern what is the rate of uptake of available services? For example, docs using jurisdictional e-services, patients using docs e-services, etc.
I think the best indication is simply the adoption of physicians who are saying they are using it. If there is certain functionalities available, EMRs are available in Canada. There's still physicians who are paper-based. I hope that answers your question. If you're looking for something more specific, by all means, please feel free to send me an email. Okay. All right. Well, I will give folks the rest of their day. Thank you so much for joining us today. And by all means, if you do have questions about today's presentation or the report that will be available in about 20 minutes, please feel free to email me. With that, have a great day and joyous holiday season, everyone.
Thank you again for joining us today. This concludes today's web conference. You may now disconnect.